where daily health is viewed as an ever-changing reality. Welcome, this is Daily Health. All information and resources are based on the opinions of the host, unless otherwise noted. All information is intended to motivate, encourage, and inspire positive change and a healthier lifestyle. Now, this podcast contains some quotations, images, and excerpts from copyrighted material. These uses fall well within the copyright doctrine of fair use. Fair use refers to the right to reproduce, use, and share. Welcome. This is Daily Health. So let's talk daily health. With all the things that's going on right now, protests and the pandemic and lack of jobs or being stressed out for going to work can affect your mental health. Today we're talking about mental health. The common triggers for bipolar episodes. Now, we all know someone with a bipolar disorder, whether it's us, whether it's a close relative or a friend or a co-worker or just an associate. Somebody knows somebody knows somebody knows somebody with the bipolar disorder. And it's very important to know some things about it, especially triggers that cause mood episodes. It helps to understand that person and what they're going through. That can help you as well as your loved one or coworker or whoever it is. Especially if you're a caretaker of someone with the bipolar disorder, this information is definitely for you. Now, these are the most common triggers for bipolar episodes. It can be anything from arguments with your mate or your spouse or partner, the cold weather, perhaps you lost a loved one or a friend. Any number of events may provoke bipolar mania or depression. So what is bipolar disorder? Bipolar disorder is characterized by symptoms including unusual shifts in mood and energy. These mood shifts or episodes last at least a week in the case of mania, and at least 2 weeks in the case of depression. Now, that can be kind of difficult to deal with, especially when you do not know what's going on with someone. And it can be very challenging. There are several types of bipolar and related disorders. And in order to be diagnosed with bipolar 1, you must have at least one manic episode that may have been preceded or followed by hypomanic or depressive episodes. Now, in the case of bipolar 2, you must have had at least one major depressive episode and at least one hypomanic episode, but never experienced a manic episode. Both mania and hypomania share the same symptoms, which include feeling unusually upbeat, euphoric, or even irritable, with increased energy, mood, elevation, a decreased need for sleep, racing thoughts, trouble concentrating, and poor judgment. In cases of mania, these symptoms are severe enough to be causing challenging problems in your day-to-day life. Take this for example. You might be unable to go to work or school, or you may be compulsively spending money. Hypomania is considered a less severe form of mania. In cases of hypomania, your daily functioning isn't significantly impacted. For example, you are able to work and socialize. When mood shifts are severe enough, they can have a big effect on your life. Some episodes of depression and mania are accompanied by loss of reality or psychosis, characterized by hallucinations or delusions. And unfortunately, it's sad, but in some cases, suicide is common, with some source estimating it to be as high as 10 to 15%. Now that's explained by Dr. Bennett. So can these episodes be avoided? Perhaps not. But understanding certain triggers can help you better manage bipolar disorder or help care for someone and help someone else manage their bipolar disorder. One of the most common bipolar triggers is stress. Negative or stressful life events were associated with mood swings. Earlier in their course, episodes of depression or mania in bipolar disorder appear to be triggered most often by stressful life events. Now, in addition with recurrent episodes, some people with bipolar disorder may experience less complete periods of remission and a greater likelihood of relapse, either to depression or mania. While causes of stress are highly individual, certain life events and lifestyle patterns may act as triggers. So you gotta watch out for these common culprits. Now, another one is changes in your sleep pattern or lack of sleep. A change in your sleep pattern is a hallmark symptom of bipolar disorder, but it can also be a trigger. Shift workers or people who work long hours and students who are short on sleep are all at risk for having a recurrence of a mood episode related to a lack of sleep. Now, in addition to that, travel beyond one's time zone can be another trigger for a mood episode. So if you're having to travel and fly, be aware, because the time zone change can trigger. So be cautious if you have to fly or you fly on the regular to different places where for you the time is off. And it can play a role in a mood episode. Interpersonal and social rhythm therapy is one of the most effective preventions. This treatment approach, available in group as well as individual sessions, help you develop an orderly life schedule of sleep, diet, and exercise. Now, these habits help to make you more effective at managing bipolar disorder. Now, other forms of therapy, including psychoeducation and cognitive behavior therapy, CBT for short, can also be helpful in managing the illness. Now, another trigger, and this is kind of a big one here. I said this in the beginning, and I can't stress this one enough. Big blowout arguments with your partner, your spouse, your girlfriend, a relative, co-workers, friends, just anyone you're having huge arguments with is a big trigger. So avoid that at all costs. Now, broken relationships are too often the result of untreated bipolar disorder. But getting into an argument with a loved one could also be a red flag. Your argument could be due to the irritability that often occurs during a manic or depressive episode, or could itself cause stress that becomes a contributing factor for a recurrent episode. Any type of relationship conflict, whether it's with your partner, coworker, family member, or friend, can trigger stress and send you over the edge. So people with bipolar disorder said negative social experiences were among the events that triggered suicidal thinking for them. So you really got to be careful in that area, because your argument may be really about nothing. It's just that you're irritated or you're feeling really sad and you just don't want to be bothered. And that person really probably isn't really doing anything, just being there or saying something to you during that period of time. So try to avoid that at all costs. If you're caring for someone with bipolar disorder, watch for that irritability or that depressive mood and kind of handle them with care and ease to try not to trigger them. That'll help rid the big, huge fallouts, blowouts, whatever you want to call it, spats or whatever. Try to avoid that. It's kind of a preventive measure, and that's always good to have preventive measures, especially with someone with this disorder. Now, a number of people with bipolar disorder, especially those with a history of severe manic episodes, have failed marriages. And if you're going through a divorce, working with your therapist through what is often a drawn out and extremely stressful process can help. You might consider a durable power of attorney that allows someone else to make major decisions for you, such as financial ones, especially when you are going through an episode of depression or mania in relation to or during a breakup. In fact, assigning a durable power of attorney could be useful for anyone who might be experiencing an episode of bipolar disorder. And it's a way of ensuring that you are cared for and your bills are paid and you've got help, so that your finances can kind of stay in order. And that could even help with your health, because they can speak up for you. They can take care of things for you during that time when you're unable to do so. Now, the next trigger is alcohol abuse and drug intoxication and the after effects. A person with bipolar disorder really should not be drinking. That's a preventive measure. If they're not drinking, they can avoid this trigger. Abusing drugs and alcohol doesn't cause bipolar disorder, but it can cause an episode to suddenly occur, or it can worsen the underlying illness. What's more, about 1 in 5 people with bipolar disorder have a substance abuse disorder. Now, that's according to an analysis of data on young adults with mental illness from an article published in February 2015 in the journal Social Psychiatric and Epidemiology. Y'all have to pardon me, my mouth is dry. Intoxication with drugs such as cocaine and amphetamines can cause or worsen manic symptoms, while the after effects of cocaine or use of alcohol are associated with worsening of depressive symptoms. So it can kind of drive a person further over the edge, and it can put them at a high risk for suicide or even committing a crime. So the preventive measure there to avoid that trigger is to, if you are bipolar, don't drink. if you're caring for someone or know someone with bipolar disorder, encourage them not to drink. That could save them a lot of stress and anxiety and mood swings and just a whole rampage. Now, antidepressants, corticosteroids, and other medication can actually be a trigger, and this is a challenging one. It's almost like a catch-22 because you're taking this medication to help, but some medications can actually make you manic, like antidepressants. The treatment of bipolar disorder can trigger episodes of mania by further setting off unstable moods and behavior. Many psychiatrists state they've seen patients enter a manic phase after starting antidepressants, and some feel uncomfortable prescribing them to bipolar patients. So, it begs the question, what should you do about bipolar depression? Until more research is available on long-term safety, Kimi Gayo, MD, PhD, a professor of psychiatry at Case Western Reserve School of Medicine in Cleveland, suggests the following. For bipolar 1 depression, antidepressants should only be used with a mood stabilizer or stabilizers after symptoms haven't responded to FDA-approved treatment options, such as mood stabilizers. Dr. Gale says that while some recent studies suggest that using an antidepressant alone is as effective as lithium taken alone for some bipolar 2 patients, those who haven't experienced a manic episode, they should never be used alone for bipolar 1 depression, and patients and doctors should consider discontinuing use of antidepressants once symptoms have responded. And I know that's very interesting. And for some, that can be a little frustrating. Now, other drugs that have been linked to manic symptoms include corticosteroids, thyroid medication, as well as appetite suppressants. So be aware of that, and don't be afraid to talk to your doctor. If you have concerns or you're feeling any type of way because you're on antidepressants, don't be afraid to bring it up with your doctor. If you're a caretaker of a person and you notice these things and you go to the doctor with them, ask questions. The doctors, they're there to help, and they need to know exactly what's going on because they're basically watching the patient and seeing what works and what doesn't work. And sometimes it takes a while to balance it out, find the right set of medications for treatment that work. So you got to kind of roll with the punches, be comfortable and open with your doctor to discuss these things. If you notice something or you feel something, let your doctor know. So that way they're aware and they can do what they need to do on their end. Now, another one that's a trigger. This one is one that a lot of people don't recognize or even think about. But when the seasons change, like a brand new season and abnormal clock genes. I know. About 20% of people with bipolar disorder experience fluctuations in mood when the weather changes. Specifically, they're more likely to undergo seasonal depression during the early winter and mania or hypomania during the spring or summer. Now, experts chalk this up to sunlight. Yeah, they do. Your circadian rhythm, the body's internal response to changes in a 24-hour day, is affected by the amount of sunlight you experience. This response is controlled by a complex set of genes commonly referred to as clock genes. If some of these genes are abnormal, you could be at risk for seasonal bipolar disorder. So be aware of that. And it helps to keep like a little notebook or a little journal. And it can really help you. And if you're a caretaker, it will really help you as well. Keep a notebook of what you notice, time of day, season, medication. It just helps to keep, records of everything. And it helps to keep it in order. And it kind of makes it less stressful a bit. Because you can look back at that notebook or that journal and you can see the patterns, the fluctuations. And it can give you a lot of answers that you're searching for. Now, another one is a visit from the stork. New baby. With altered sleep patterns and shifting hormones. Now, the American College of Obstetrics and Gynecology estimates that women with bipolar disorder have up to a 67% chance of experiencing an episode of bipolar disorder in the postpartum period. Now, that's the weeks and months after birth. Changing sleep patterns, altered medication prescriptions, and shifting hormones after delivery can combine to serve as risk factors for a postpartum mood or psychotic episode. Use the 9 months of pregnancy to work with your entire medical team, your bipolar disorder specialist, and your OBGYN on treatment approaches you can try during and after pregnancy to help prevent postpartum depression, postpartum mania, or postpartum psychosis. Bipolar disorder is also strongly associated with postpartum psychosis, which is a severe mental illness characterized by an inability to respond emotionally to one's newborn or thoughts of harming one's baby. And this happens more often than we know. It really does. And when there's no one around to notice these things or care for this person, bad things can happen. There's a big risk for it. So it's very important to have a good support system. Now, another one is financial and emotional strains due to a job loss. Especially right now, there's a lot of companies that are going under, that have laid off, that have to transition some of their workers to work at home. All these things can be stressful. Now, one of life's most unpredictable stressors, losing your job. And the emotions you may feel about your job loss can be equally unpredictable. People who weren't satisfied with their work can find it liberating. For others, the financial and emotional strains involved can trigger major stress. Either way, the dramatic shift in emotions could trigger a bipolar episode. So it may be a good idea to put away 3 to 6 months of saving to help with the transition should you lose your job. That's that rainy day fund. That's that rainy day fund. And a lot of people may call it something different. Some people call it, just in case, rainy day fund, or even a stash. But it's very wise to do that. Especially right now because the world is kind of iffy right now on a lot of things. And that's stressful enough. So if you are working, always try to have a little nest egg, just in case. That can help save you some energy and stay off that emotional roller coaster. That's what I call it, emotional roller coaster. One that you're on that you don't want to be on, but you can't help it. Yeah, that. Now, another trigger is dealing with grief. It's the loss. And loss can be very difficult for a person with a bipolar disorder. Either type. For a person that doesn't have a mental disorder, it's very hard on them. So imagine a person with bipolar disorder. Their experience, it's much more greater. It's almost like a suffocating feeling for them. Everything is like amplified. To where for you, if you had to rate how you feel on loss and grief, you would rate it probably at anywhere between 8 and 10. But for a bipolar person, for them, it's off the scale. For them, instead of it being 8 to 10, it's going to be 15 to 20 or 17 to 20 or maybe 23 or higher. The experience is totally different. They have similarities, but with bipolar disorder, it's much harder to handle. Now, the death of a loved one may be the most stressful life event any of us will ever face. Many people continue managing bipolar disorder successfully through their mourning, but it may have extreme consequences for others who can develop funeral mania. This occurs when someone with controlled bipolar disorder attends the funeral of a loved one and has a manic episode over the course of the following week. Now, the period of bereavement should be one of increased monitoring and heightened support. Prevention of a bipolar mood episode may not be possible, but understanding triggers may aid and help you better manage your illness or someone that you love. So these are the common triggers. Now that you are aware, you can use this information as preventive measures. Bipolar disorder is very challenging to deal with, and a support system is greatly needed. And whether they understand it or not, caregivers, supporters are greatly appreciated and needed. So kudos to those who are caregivers or supporters of a person who has bipolar. Thank you for caring for them. Keep up the good work. And this has been your mental health common triggers for bipolar episodes. So take care.